last time the Trump administration was in office, he they did this thing where they tried to prevent federal funding to anyone who talks about diversity, LGBTQ folks, trans folks. And so how HIV organizations are going to function or provide competent services um, without being able to talk about race, without being able to say that, HIV is disproportionately affecting the Black community because of years of discrimination and racism, and that doctors need to be aware of the social determinants to health and how Black folks are treated in the medical setting. And, that relevant education is just going to really hamper the years of effort that's been built up over the years. So that's another big thing. And just other things off the top of my head. There's the Comstock Act. That's the act that says that you cannot send anything obscene over the mail. And we know that the other side really wants to weaponize it and use it again, specifically for abortifacients, but it could also be used for STI prevention tools like condoms, um, dental dams, PrEP. That could be used against folks living with HIV. HIV is so intertwined with racial justice, with LGBTQ, and those are the two communities most at risk. And so an attack on people of color, especially Black women, um, and attacks on LGBTQ communities, especially the trans community, uh, will disproportionately harm and hurt folks living with HIVs.
I think everything's on the table right now, and that's our job is to educate the new administration, educate the new Congress about the value of HIV prevention, research, testing, treatment, PrEP. President Trump, in his last term, established the Ending the HIV Epidemic Initiative and funded it and implemented it. So, we don't know what the second term is going to bring. And but right now we're in the process of reaching out to the new administration, reminding them of that program, showing them the results, and encouraging them then to continue that in the future. You know, yes, everything is being looked at and examined, but you can't take away healthcare from people living with HIV. It is a lifetime requirement. And unfortunately, we don't have the private insurance, adequate private insurance, adequate Medicaid programs to ensure that people have that care and treatment and the support services, the case management and things like that to make sure people stay adherent to their medications. So I think it would be really hard to take away, medications from people who are taking them because that would be bad medicine and very dangerous for people's lives and for our society and the public health.